start with the obvious, right? Shall we? I mean, back pain. It's inevitable, whether we are sitting down, hunched over, we get hurt playing a sport, age. I mean, we could just go on and on, but it's going to lead me to this question from Tom. So let's take this viewer question and I'm going to read it to you and see what you have to say. And I broke a vertebra in my back on a skiing trip a month ago. I'm so sorry, Tom. I rested and took it easy and I appear to be doing fine. Am I more vulnerable to back injuries now? I am an otherwise healthy man in my mid-50s. So it's great that he's getting better, Dr. Mena, but Tom asks a very good question. Is he more vulnerable now?
Yeah, good question, Tom. We get that a lot in office as well. That's a traumatic fracture. You're in the mid-50s, unless you have a history of osteoporosis or there's a bone washout. Normally the answer should be no. However, there's a history of osteoporosis or the bone is a little more brittle, then the chances increases once you have a fracture, it increases threefold in developing a subsequent fracture within the next year. It goes to 5 if you develop 2 fractures, and goes to 10 if you develop 3 fractures. So the risk increases exponentially as you start developing more fracture. But keeping in mind you're in your mid-50s, it was a traumatic fracture, so very unlikely you're going to develop another subsequent fracture. You can have a normal lifestyle and everything should be fine.
Fantastic, and we wish him well as well. Just in case you're just joining us, we are speaking with Dr. Jose Mena. He's an interventional spine specialist with Miami Orthopedics and Sports Medicine Institute. Doctor, I want to get to a question from Steve, and I think this is a great question as well. Let's take a look at it real quick. Is spinal fusion surgery an outdated treatment for bulging or herniated discs? Good question there, Steve. Doctor?
Good question, Steve. The answer right now for herniated disc, depending. So if the herniated disc is touching a nerve and you're developing what we call sciatica, you're having symptoms going on the leg, so that will be a micro discectomy. So basically, the piece of the disc is being removed, and all of a sudden the pressure is being released on the nerve. Now, if the problem is related to discogenic pain stemming out from the disc, traditionally speaking, the surgery has been fusion. Nowadays, there's a newer technique, which is what we call total disc replacement. So the disc that is being diseased is being removed and an artificial disc is being placed. Of course, there are some advantages with that total disc replacement to a fusion. Traditionally, the studies have been going on through fusion. So normally once you fuse that level, normally you're putting a lot of stress on the level above and below. So those levels are getting more of the burden. So you can develop what we call an adjacent segment disorder, meaning that there might be a breakdown of the level above or below the fusion. Total disc replacement replaces that, so that level still moving, so the level above or the level below, they don't get a lot of burden from that disc or from that segment. So the chances are less of developing an adjacent segment disorder.
I want to talk about sciatica because, my goodness, I'm just going to take a guess here and say that this is extremely common. So how common is sciatica? That's my first question. What causes the pain, and can it go away on its own? 3 big questions there, doctor.
3 questions. So good questions, actually. So the first question, the first answer for the first question is extremely common. We see that all the time in clinics. So the answer is yes. Related to what causes sciatica, there's a lot of things that can cause sciatica. So for the viewers, what sciatica? So sciatica basically is a compressed nerve in your back. So that will send signals. So the nerve are like electrical wires. So if a nerve is being pinched, you're going to feel it going on the leg. In this case, if it's coming out from the back. So typically it will be something that might be pinching up on the nerve. The most common thing will be a herniated disc. So herniated disc by far is one of the most common things or most common conditions that will develop into sciatica. Other possibilities will be arthritis of the back, meaning spinal stenosis or narrowing of the spine due to arthritis. So normally when the nerve is running outside from the spine, it's being compressed, and that will irritate the nerve, and that can cause you the symptoms of sciatica. Sciatica by itself is just an inflammation of the nerve because it's being pinched, and that will trigger symptoms, in this case, going on the legs. Sciatica going on its own, depending. Most of the time, if it's related to a disc herniation, we know that we look at studies, 76% of disc herniation, they resolve. So they get reabsorbed back by the body. So meaning most of those cases are gonna be favorable. They're going to respond and the sciatica might go away. Now, when you have a fixed lesion, meaning that you have due to arthritis or stenosis, stenosis meaning narrowing, normally you already have a fixed lesion. The possibilities are less likely for the sciatica to go away, so you might need to have some treatments for that. But however, for the most part, the treatment itself for sciatica, meaning exercises, injections, and/or surgery, basically are favorable, keeping in mind that most of the patients, they're going to respond to conservative care, meaning an exercise program.
And just to end with sciatica, one last question, doctor. After those treatments, are you out of the woods, or is this something that can return again?
It can return again. So we know from statistics that that once you have an episode of a sciatica, there's a 50% chance that your symptoms can, although 90% of them might go away, 50% of them can recur within 1 year without treatment. So that's why you want to be proactive. Unless, and keeping in mind, symptoms they gone away, should I seek care? The answer is yes, because you can still are at risk of developing 50% chance of these patients of developing another episode, and that's where you want to be proactive, treat it, get those core muscles, those muscles engaged stronger, and that will decrease the likelihood of having another sciatica episode.
Great stuff. Okay, doctor, I have a video question, and this one is from Dean. Let's see what they have to say.
All right.
Hello, doctor. My name is Dean. My question is pretty straightforward. As you age, you're starting to get more and more complications with regard to back and back pain. Do you have some suggestions as to how you can mitigate back or back pain and maybe even strengthen the back? Thank you.
Oh, I love that question from Dean. Ooh.
That's an excellent question from that Dean has brought us. And actually, that's a very good question, and actually is giving us like some of the things that patients, they would like to know, what things we can do to mitigate or decrease the likelihood of having chronic back problems. The answer is yes. You are be able to treat you have full control of the treatment of avoiding. And the answer is actually getting an exercise, a dedicated, tailored exercise program for your condition. Normally, there's a list of a bunch of exercises. If you look in the internet, you're going to find them. However, there are exercises for certain conditions, and that's why you need the help of a professional. So normally, our goal as physicians is just to identify what the reason of your problem, but we normally rely on a healthcare provider, which is a physical therapist, who are well-versed in knowing the treatments or the exercises for the different type of spinal conditions. So normally we write them, we have a suspicion that the patient might have spinal stenosis, the patient might have lumbar spondylosis or arthritis of the spine, or the patient has a herniated disc. So normally we send that to a physical therapist with a detailed prescription. So the physical therapist might be able to evaluate the patient, see what are the needs, what areas the patient is weak, what areas the patient might need to be more flexible, and they will custom tailor an exercise program for you. You might have a different condition, and your exercise program might be completely different to a neighbor of yours that they're suffering from back problem for another different condition. So typically we'll be seeing your provider for them to find out what's the root and the cause of the problem, and normally developing an exercise like a prescription for physical therapy. So you should be able to get an dedicated exercise program, and you should be able to benefit yourself in the long term. And the most important part of the problem is actually to keep doing those exercises despite, and I tell that to every patient, although you might be 100%, you want to keep doing those exercises, and you want to keep working on those core muscles in order for prevention purposes.